Good morning. In this segment, we're talking about headaches. And there are three basic common types of headaches. There are more, obviously, but I'm going to give you three here today. And the first, of course, we talk about headaches that are either intracranial, meaning inside the brain, inside the skull, or they're extracranial, which means they come from the neck below. So the first common type of headache, and the most common type of headache, thank goodness, are what we call muscle contraction headaches. In the media, you hear these referred to as tension headaches. And basically, these are from contractions, just like the name implies, muscle contraction, from contraction of muscles in the spine of the neck, because they attach at the base of the skull. And as these muscle fibers contract, they start to pull on nerve endings and fibers that attach to the skull. And so the patient comes in and basically tells me, I have pain that's back here and it's causing a headache, and that headache may radiate up into the side or the front of my head. It may even feel band-like. These headaches typically occur in the morning, early morning hours, and may reoccur in the late afternoon and early evening hours. And those headaches can be very chronic. I always say that these headaches may last 2 days, 2 weeks, or 2 months and occur every day. And if you have that type of headache, you know how chronic and at times disabling that can be. The second type of headache is what we call an intracranial headache or a vascular headache. And again, in the common media, these are called migraine headaches. Migraine headaches are best described like electrical storms going off in the brain, and almost like short circuitry of the neurons, and they're exploding. And this gives the patient typically a unilateral headache behind the eye. It'll feel like somebody's boring into their eye, and these are very disabling headaches. Typically, they begin in the morning. The patient has some sort of aura. They may see flashing lights or decreased fields of vision. But these are very disabling headaches. The other characteristic feature of these is that the patient will say, you know, I began to have these headaches when I was 13 or 14. Typically females, post-pubescent age range. And a lot of times they'll come to me and say, I've been on migraine medications for years, and they're looking for a way to decrease the frequency and the severity of these headaches. The third type is what we call a mixed headache, and these are both intracranial and extracranial headaches. That means that they're a combination of a muscle contraction headache from the neck and the muscles and from a vascular event inside the brain. And those can be very tricky, because the patient will say, well, I have most of my symptoms are the type behind the head and the back of my neck, but I also have some of these symptoms that you described earlier, the flashes of light, the feeling of an aura that this is coming on, maybe unilateral, and we describe those as mixed or complex headaches. Now, what do we do in chiropractic to treat this? Well, if it's a muscle contraction headache, we use myofascial release to treat the back neck muscles. We can use cervical traction. We can use physical therapy modalities such as ultrasound and muscle stim. Obviously, we'll also use chiropractic manipulation to increase the motion of the joints in the neck. That relieves the tension on the muscles that attach to those joints, and then so those are the most common types of headaches that we'll encounter, and we'll talk about more serious types of headaches in the future. Thank you.